caring for our pets means making a million little decisions about their health and happiness. And if you know me at all, you know this stuff matters to me because I'm the proud parent of the sweetest kitty on the planet, Frank. So today I'm chatting with Dr. Ray Davis and Dr. Stephen Beal from Livewell Animal Hospital. And you guys have more information for me too on the community-focused approach to vet care. Thank you for being here, y'all.
Yeah, thank you for having us.
So first off, we're going to start with, for someone that's never heard of you all, what is Livewell?
Yeah, so Livewell is accessible, modern, high-quality medicine that still maintains a focus in the community for community involvement, and each clinic still maintains a lot of individuality among Livewells.
Oh, okay. And can you explain the difference between urgent care and general practice as well?
Yeah, so I am Livewell Animal Hospital of Kirkland, which is general practice, and Dr. Bill is in Bothell at Livewell Animal Urgent Care of Bothell. And the difference between those two are really going to be the urgency at which something needs to be seen. So as a general practitioner, the majority of my schedule is often booked with wellness and sick appointments. Of course, when my clients call, we get in everything we can and say yes. But urgent care is really going to meet that in-between need of maybe there isn't that availability, but you can go and be seen for something that is a more urgent case and needs to be taken care of right away.
That makes sense. And I want to get you in here. What are some signs that tell you, yep, this is absolutely an urgent care moment?
Well, I think a lot of owners, I say this all the time, you know your pet best. And so anytime your pet's just not acting their normal self would be something to look into. So I wouldn't necessarily say it's an emergency, but if your pet's not eating right, maybe they have diarrhea, they're vomiting. Obviously, if they're shaking their head, might be signs of an ear infection. And of course, you have the puppies who love to eat things they're not supposed to. So in those instances, it's definitely worth calling in at least just to say, hey, do you think I should be seen or not?
Okay, that's great that you can even call in and talk to an actual person, and you guys can say one way or another. We had a lab that ate everything growing up. Okay, like he was like choked down rocks. It was really bizarre. What makes your hospitals different too?
Yeah, I would say the thing about Livewell is they want us to have individuality, autonomy to kind of set the hospital up the way we want to. And so obviously GP versus urgent care, two different things there, but the way I operate my hospital is not necessarily the same way that Dr. Ray operates her hospital, but we really have a big focus on communication with our clients.
That's amazing. And why is it so important to have a place that's almost a one-stop shop for your pet? Like really everything is handled there.
I think what's important there is, unfortunately, the cost of care continues to rise. That's, outside of vet med and everywhere. And when we think of specialty practice, there's always going to be a place for specialty care. So things that we can't handle, but the more we can offer in clinic. So wellness, surgery, I do a good bit of oncology and chemotherapy as well. Dr. Bill does a ton of emergency surgical procedures. But it's kind of a place where if we can say yes and we have the skills and tools to do it, it at least helps with the accessibility of it for a lot of people.
Do you feel like then pet owners are a little less anxious when they're coming in to you all because it is a one-stop shop and they know if it needs to kind of move to an urgent care situation, they're at the right place?
Yeah, it's just really nice to have relationships, and for the veterinary community as a whole, a lot of the general practices really want to have those relationships with their clients, and it gets tough sometimes when you get passed around to different places. Everyone, of course, is trying to provide the best medicine for your pet, but it can be a little bit difficult to communicate with owners when they don't really know you, and it's kind of nice to have everything kind of all in one.
Oh, absolutely. You both have such interesting backgrounds too. So what are your special passions in veterinary medicine?
For me, in vet med, I'm fear-free certified, so I really care a lot about maintaining just long-term relationships with both the pets and clients, and I think as least stressful as we can make those experiences, the better for everyone. And then soft tissue surgery and chronic pain management. I think we've come a really long way with identifying chronic pain in pets, even from the vet side, but also as pet parents being able to recognize that themselves. And we have a lot more options for management of that in our senior pets.
Yeah, I would say for me, I enjoy the variety of urgent care. Definitely in our field, I enjoy really partnering with, clients as far as, creating a treatment plan around what they're aiming for their pet, and, just providing them with the best options available to that pet. Maybe they can't do the top tier approach that we would all love to do, but, we're going to find solutions, and, I try to work with them to figure out what that is.
Great. And you're taking new patients, I understand.
Yes.
So how can someone, of course, book an appointment?
Our website is livewellanimal.com, and each location is going to be different, but you can book directly on our website.
And you have a couple locations too, right, in this area?
Bothell and in Kirkland right now.
Yes.
Amazing. Thank you both for being here.
Yeah, thank you.
And to learn more about Livewell Animal Hospitals in Kirkland and Bothell, please just visit the websites on your screen. You can book today for $50 off your first visit.
New Day Northwest is sponsored by Livewell Animal Hospital.